My name is Lidia Schapira. I'm a professor of medicine at Stanford. I'm a medical oncologist, and I'm the first director of the cancer survivorship program at Stanford Medicine. The physical symptoms are only part of the experience of being a cancer patient and survivor. There's a whole other aspect to the experience that has to do with the emotions, the psychological adaptation, what we call coping, and then all of the ways in which these experiences affect the future life. So how somebody interprets, for instance, all of their surgeries and the changes in their body may also impact on how they feel about themselves. We have always known and understood that people living with cancer and beyond need to be supported, but we're just trying to understand and have a better grasp now of what it is that we can do to actually help people to feel more confident about their body's ability to manage cancer and their future health, and to actually feel that they are ready to take on all of these physical and emotional challenges. As a medical oncologist who takes care of women with breast cancer, I have been very impressed over the years by seeing how different women experience the changes in their bodies, the loss of a breast, or sometimes loss of fertility, sometimes changes in their body because of premature menopause, and also very impressed with the resiliency and all of the ways in which women overcome many of these very important physical consequences of cancer and cancer treatment. Our research now is showing that we can actually target how women think about their cancer and their body, what their mindset is, what they pay attention to, and do it in such a way that we can help them to feel better about themselves and even feel less pain and fewer physical symptoms. This is very exciting research. It's in its early phase, but I think it has great potential to help a whole lot of people who are diagnosed with cancer. When a friend or somebody I know tells me they've been diagnosed with cancer, the first advice I give is usually to sort of just take a deep breath and give themselves a little self-compassion. I think it's really important for people diagnosed, women with breast cancer, and caregivers and loved ones to really do all of the things that bring them comfort and soothe them and bring them solace. And that's where many of these mind-body techniques may also be very helpful. Things such as relaxation techniques, yoga, breathing, physical activity, and also connecting with others, either through a love of a shared activity like hiking or singing in a choir, or sometimes in formal support groups. I think it's really important for somebody with cancer not to feel that they're doing this alone. So feeling social support, feeling connection to others, and also trying to take the time and doing things that help them feel calm and at ease is really important and can really provide sort of the necessary strength to go through a difficult experience such as cancer treatment.